not because I have the expertise, but I would say it's a privilege for me to share my view regarding the fight against the COVID. So I will start to quote, which a quote I state says, young people are the backbone to every institution, nation, infrastructural development for the sustainable growth and development of a nation. I will make a reference to my country back here in Sierra Leone, and my country went through 11 years of civil war, which young people were in the front line of the war. And after the 11 years of civil war, we categorically came into a democratic state of election, and we are going to have our first and democratic election. In 2013, 2015, of course, we all know the Ebola outbreak that came into Africa, which led to so many loss of young people. And as well, I just want to share a view across the world about young people taking the lead in the fight against pandemic. And so I will start with the experience I have from the Ebola down to the Corona, which we have already fight as a nation, and we have ensured we liberate totally the massive spread of the COVID in our country. So one of the roles and responsibility we took as young people, one, we ensured that we mount the responsibility, we take up leadership as young people in our country, which I will say definitely as our brother and sister country are going through the pandemic, the Indians, the Pakistans, and that of America. I'm going to share this point of view with you guys, young people across the world, that we are the focal point of change. And if we have to see the drive in which we want to end the pandemic, definitely we need to take up responsibility. We need to take up ownership of the fight. The fight is not a government fight, neither an institutional fight. The fight is our fight as young people, because we are the backbone to our nation. For a nation to be developed and sustainable, it requires the efforts and synergy of young people. And if we are going through this traumatic stage of the pandemic, which is massively disintegrating our people, on our mother, on our fathers, on our brothers, on our friends, which have led to so many loss of lives, definitely it's called for a concern, it's called for a responsibility for us to take up the mantle of leadership, to spread out the relevant information that is relevant for it to be passed on. And I will share this with you. One of the major concern, or one of the major issues that has spread, that have caused the spread of the virus, is the information that we are passing on. Earlier on, I was sharing a view with another platform where I talk about the psychosocial mental of people, how they accept and receive the information being passed on into the social media. You know, the greatest tools of communication in our generation currently, as the world has moved into the digital trends or into the digital revolution, definitely is technology. And all of the informations we pass on is being passed on by young people, because we have the time, we have the energy, we have the courage, we have the patience to pass on all of those information that is being passed on social media. So what we need to do now, we need to ensure the least people in our community have the awareness, have the knowledge about the pandemic. And we need to ensure as young people in our various country that people accept and realize that the pandemic is real, it's not a makeup, because we have this psychosocial thinking that the pandemic is being made up by a set of people, or by a group of biochemists, or by people who just think that they want to get away with the world. You know, one of my friends was sharing a view with me about the statement made by Bill Gates. Of course, as you all know, Bill Gates is one of the richest man on earth, I would say. And the statement that he stated, that the world is so populated and we need to eradicate or reduce the population of the world. And which that particular message has so seldom into the mindset of so many people. Someone did a research. In the research, it stated that Bill Gates is one of the donor. It's one of the highest donor to the biochemist or the lab that developed the vaccine or the COVID vaccine. So could you imagine? He was telling me that Bill Gates is one of the reasons that this pandemic is still ongoing, because during his statement, he stated that the most populated areas or locations across the world need to reduce their population, in which he made mention of India, he made mention of Africa, he made mention of some other areas. And that information keep flowing. So people don't want to accept, or people don't want to believe that the pandemic is something that we really eradicate or wipe off the planet. So one of the major roles as young people, we need to pass on relevant information that we set down into the history. And what we did here in Sierra Leone, when the pandemic arrived, all of the young people came together. We held a meeting in the house of the Ministry of Youth. We discussed strategy as to how we should mount and fight against the COVID. One of the strategies that we put in place, or one of the strategies that we outlined, was we need to provide essential productivity of health service and corporateship as young people. You know, the frontline workers are not enough to fight the COVID, though they are the expert people, but we need to sacrifice ourselves to be in the front line. You know, there are so many people down in our villages and towns. They don't have access to good medical facility. They don't have access to good information that will keep them posted about the pros and cons of this particular pandemic. So one of the things we did as young people, we ensure the message and information about COVID was reached to the least people. We launched a campaign, people to have the knowledge for them. Guess what? After they have had effective education about COVID, have effective knowledge about COVID, definitely they were able to accept and realize that the pandemic is something that will destroy life if we don't adhere to the necessary precautions that has been outlined by the medical personnel. And the second thing we did, we agreed to do, is for us to use the social media. It's for us to use the social media to spread accurate and vital information, because all of the information that is going around social media is of the negative impact. You know, you will wake up one day in the morning on the news, you heard that 2,000 people have died in India, 5,000, 10,000 people have died in India, 20,000 people have died in China. So guess what? Automatically, you have put the person into a psychological trauma. The person will be traumatized. He will just think now, okay, I'm in India. If 10,000 or 20,000 people have already died, they will definitely accept or agree to themselves that psychosocially that they are the next person, despite the pandemic have not even reached to their environment or community. So we need to make good use of social media. We pass on relevant information that will help to save life. We pass on relevant information that will help to keep our environment and community safe. Some of the message that we need to be passionate on, we to tell people to adhere to the necessary precaution. One, to always put on their face masks, adhere to the precautions, avoid social gathering, stay home if you think it's not really important for you to go out. Give them those relevant information, explain to them the relevancy for them to keep themselves safe and for them to disassociate from social gathering, from large scale of gathering, so that we may be able to stop the spread of the virus within our community. And we should also take the front line in the fight against the COVID. We are so resilient, we are so strong. The virus does not easily react into our system, despite the older people. You know, when they are old, their lungs and their intestines are so weak. But as for us as young people, it is very hard for us to be intoxicated and for us to be for us to be easily overwhelmed with this virus. So we need to take the front line to ensure we really put up a very good fight in the fight against COVID. And thirdly, what we have done, speaking to effectively and accurately to give them the accurate information. Because information is the major tools of transformation. So, thirdly, we need to tell people about their mental health. Mental health is very, very, very key here. It's very, very important because a lot of people, a lot
Brother, it's muted.
okay, okay. So these are the other thing, championing campaign on mental health issue. This some of our old grandpapas, our old daddies, they can easily react to situation based on the information they acquired. When you acquire urgent information, normally there are a lot of issues that trend around the world. Our fathers have heart problem, they have some other illness that we easily react to some of those urgent information that we pass on. You understand? So we need to know how we mantle and pass on relevant information within our communities. And fifthly, number five thing we agreed on, we should innovate a creative way to have easy access to medical facility. Young people serving as volunteer for our community people to have easy access to medical facility. We making the sacrifice, we taking the lead. So many people don't want to volunteer when it comes to issues like this because they themselves think they are going to lose their life in the era of fighting the pandemic. So many people are not like, they are not really how will I say it? They don't really have confidence in themselves. That you putting up the seal, you putting up the mantle of volunteerism to ensure people have access to good medical facility in our own different ways. Some of us have different youth organizations in which we work actively on. Some of us have different platforms we use to do our various work. So by taking up the responsibility to ensure the least people in your community have grotesque information about what this particular fight is all about, I think it will help a lot. And the other thing we agree on, we need to conduct our research about how this particular pandemic, now the pandemic is in the second wave. The virus or the vaccine that was invented, definitely I'm not seeing it reciprocating to this particular wave that have come in, and we are seeing it as a result. So many people are dying, so many people are losing their lives. So we have to take up the responsibility as young people. Some of us are medical practitioners, some of us are researchers. We need to help the government in providing them adequate information as to ways in which they will mount up the fight, since they have the finance, they have the strategy, they have the equipment to ensure we minimize. So we need to take up that role to ensure we provide relevant information and result to the government to ensure they have easy access in the fight against COVID-19. And the other thing that we agreed 7 was how we can strengthen the communication. You understand? While I'm focusing on communication, we know, of course, the informational aspect of life is more key, because whatever information I acquire today is what I will ignite or what I will work on. So we need to have a strategic way ways in which we pass on some of those information that we think which we did help the security apparatus. So we find out that all of the incomers or all of the foreigners coming into our country, they were seriously and highly scrutinized, and some of them entering in our country after they have gone through the medical based on the COVID-19 proceedings. Definitely, these are ways we did manage to tackle or to handle some of those issues. And another things we engage on, we engage on delivering food and sanitation. You know, you cannot, if in the midst of the pandemic, of course, we all know when the pandemic is really serious and very hectic, the government declare coffee order, it declare quarantine, it declare lockdown. So if people does not have access to the social platform, some people used to go out for job, some people used to go out every day to fight for their daily bread. Definitely, if they have been deprived from all of those things, some will be economically broke because they are no longer working. Some will not have the access to food, because we all know we have three races of life. We have the lower, we have the medium, and we have the upper race of life. Some can provide by themselves, some cannot provide by themselves, some depends on other. So as youth, we need to ensure our community is a major priority. How? We lobby to our stakeholders to ensure these people that have been quarantined or these people that have been in lockdown have access to sanitation, have access to food, because these are some of the things that will devastate someone. These are some of the things that will make someone mentally disturbed. Because if you cannot have access to food, you cannot have access to good medication, if you cannot have access to what you have been doing, some have been employed, and based on the COVID criteria in Africa here, all of the investors went back to their country. And I know even in India, so many business places, so many offices have been shut down. And you know, these people have been employed, and now they have locked down or shut down their various offices or business center. Definitely, guess what? They will be mentally disturbed, they will be mentally devastated. So what we should do as young people is to ensure we reach out to those people with relevant information, with relevant support, let them feel belong, let them feel part of the society. We'll be able to tackle and end the fight against the pandemic. And the other thing that we agreed on is to engage the landmark or the framework or the trend in which the pandemic is moving. You know, of course, as you can see now, and the result is all over the news everywhere. Of course, India is like having every day almost the highest cases around the world. And for youth in India currently, I will advise you now what you need to do as young people. One is to join force with the government, and I will as well advise the government of India to give a strong support to young people, because they are the only people who can sacrifice themselves to be in the front line and ensure we end the pandemic in our country. Give young people the support they need. I know there are a lot of youth organizations, there are a lot of young people who are willing to take up the challenge, but they only need the support for them to move and stand in the front line. One thing we need to accept and realize, they are very energetic when it comes to innovation, ideology. They are very accurate in those areas. So we need to give them the support that they require to ensure we end the fight. Our governments here in Sierra Leone gave us the clear platform. Our governments relied on us 70% to ensure we really end, but ensure we mitigate the operation of the COVID in our country, and in which we succeeded, because we were so vigorous about the operation, we were so energetic about the operation, we are so serious to ensure the COVID does not spread or kill our people just the way it did during Ebola pandemic, because as you all know, Sierra Leone resulted the highest case, I would say, in Africa. So we have learned from some of those things. We ensure we tackle and infiltrate some of those skills that we had during in the Ebola pandemic. We implement them in this particular area of COVID. So government needs to give the support to young people in India. Let them be at the front line because they have the energy, they have the ideas, they have the skills, they have the ways and manner in which they convince their people. Because our people, our parents, our friends, our colleagues listen to us. Some of us, they are seeing us as mentors. Some of us have been inspiring them in several locations. So if you give us the opportunity as young people, definitely we'll be able to convince our people, our community leaders, our stakeholders. You understand? So these are some of the things I think the government needs to do, giving the young people the clear platform to run and handle the operation in the fight against the pandemic. I think we're able to manage some of those things. And lastly, as we all know, medical facility or biochemists are people who are, at times I always say they are not reliable, and at the same time they are reliable, because you will see today a physician will develop a solution to a particular problem, and tomorrow another will stand against it, and tomorrow another will prolong against it. So definitely, as young people, we need to ensure the effectiveness. Our people, our country, our community is our major priority. We need to stand on the front line to ensure really the life and safety of our people is our major concern. The safety of our people is our responsibility, and we can only succeed that if we come together as young people. I believe so many young people in India are part of the Yongo platform. Yongo platform is one of the biggest youth constituencies around the world, which they discuss aimlessly, provide solutions in which they can use to fight. They can use in the fight against the pandemic. And so I will lastly close with this. One, we need to have respect for each other. We need to believe in ourselves as young people. You understand? Don't say because you are educated, you are at the front line. I watched a video recently. One of the guy was wearing a face mask, and then the other was not putting on a face mask. And the one who was putting on a face mask was an elite, and the one that was not putting on a face mask, like he didn't go to better school and he does not understand the proceedings of the process. And literally, the guy failed to understand that this young man does not understand anything probably to the proceedings and process of COVID-19 would. And he came in contact, but this young guy have an heart problem. And by the way, he fall down. This man, just because he's an elite and he think he's more superior than this guy, he definitely rejected to help him. And guess what? After he has gone by, another came by and say, no, this guy, I think he's in critical condition. I need to help him. So the process in which we pass on our information make our community or make our environment so chaotic about the operation. You can see someone dying, you are in the capacity to help the person just because you know it's a period of COVID and you don't even care about what is happening, the life, the person itself, just because you are hearing about COVID. Definitely you say, I will not be the right person to help. So we need to be constructively listening and understand the process instead of us listening and respond. You know, there are two different things. You listen constructively and understand instead of you listening constructively and respond. These are some of the things the medical people are doing. Some of them just listen constructively, they don't understand, but they respond proactively, and which has led to so many loss of life. Over here in Africa, so many people have hypertension, so many people have hypertension. So when they hear an ambulance passing by, they will think, oh, this is for me, and this is what I'm going to go through. So psychologically, you have killed the person with your action and with your response. Of course, we all know the pandemic is something that we should not play along with. So these are some of the things we need to be doing. And lastly, the therapy. We need to understand the therapy. Yes, sir.
Please, in the interest of time,
Last, let me just try to round up. So the therapy, we need to understand the therapy. We need to really understand what is happening within our environment and accept it the way it is, and we're able to minimize them. So this, I will say, thank you to young people, and this fight is our fight. We need to stand firm. We ensure we end the fight against the pandemic and we eradicate pandemic in the world. Not only our various country, but we have to end it. A lot of people need to be called to justice. Like the statement made by Bill Gates, it needs to be looked into considerably, because these are some of the statements that will bring insight to a nation or to the world. So thank you so much.
Thank you so much, brother. Really, you are wonderful and absolutely fantastic speaker. We have to conduct a special program for you, because the way you have presented with statistics and the point wise, that's really amazing, brother. You have a bright future. You will become the person who decides the fate of the international community. Keep going, brother. The hurdles will come, problems will come, challenges will come, but never stop, because God
Right,
has
sir.
given you, yes, God has given you that skill. You can ignite thousands of minds, millions of brains. So be courageous and never stop, never look back. Thank you, brother. We are honored to have your presence in this occasion. By giving wonderful inputs to this program, you have made it a day. Thank you so much. Now it's the time to invite our second speaker, Dr. Vargheese KJ, an associate professor, research scholar from Christ College, an autonomous Christ College in Kerala. Brother, over to you, Dr. Vargheese.
Thank you, Dr. Raja Rao, and the global community for giving me a chance to speak on this particular topic. Because I deal with youth, being a professor, I deal with youth, and I see how they put a fight against this COVID pandemic. And at the outset, I would like to congratulate the youth in general, because as it is said, India is a young democracy, or India has almost 30% of its population youth. So naturally, almost one third of the India's population is youth. So naturally, our youth is putting up a wonderful show to fight this pandemic. So I would like to congratulate the youth all over India and all over the world who are in the forefront as health workers, as doctors, as researchers, as social activists. And they are wonderful, putting up a wonderful show and saving the whole world from the pandemic. So I find there are many ways in which youth can really hope to fight the pandemic. One of them is they are digital natives. And since they are digital natives, they are very comfortable with social media. It is said that there are two diseases now affecting the world, spreading, super spread. One is COVID, and the other one is fake news. Fake news about COVID. And how can we fight this? And that often creates panic among all people. So this fake news can be very well fought, especially by the youth through the use of social media, because they are digital natives. They are quite comfortable with the social media. So when they give right news, when they give accurate information, naturally people will be away from this panic. And I even find there are youth often who create apps. Okay, apps especially in the local languages, so that the old people and all others can find where the vaccines are available, where the doctors are available, where to go for what we call treatment. So I should congratulate youth for that, and I also so exhort youth, especially in the IT field. I think creating an app nowadays, especially with the ICTs and knowledge that they have, is not that difficult. So many are doing it now, and these apps which they create, especially in local language, often helps the people a lot to overcome panic, because when the fake news comes, people are in panic and they find it difficult often to overcome, and they often search for the right news. So the right information, right news, etc., would help, and it will also would like to break the myths regarding coronavirus. There are a lot of disbeliefs, wrong notions about this particular disease, which can be very well fought through social media and these kind of apps. And one very important thing is that during these times, our mental health is very much affected. Okay, our mental health is affected, and I would exhort our young minds and young people to fight, to champion this cause, to become the champions of mental health through the right information. When people get right information, they are not stressed. So, many of our youth are, and in our place, the people are forming groups like Young Brigade, a Young Men Army. Doesn't mean men means there are also girls present, and they often reach the people. Especially, it's a situation when the whole family is affected with COVID. Sometimes they cannot get food, they cannot get the groceries and medicine because they are not allowed to go out. They'll be in quarantine. So these young people, okay, maybe in the form of social activism. They belong to different groups, different religious backgrounds, but all of them come together. They may be belonging to different political parties, different religions, and different beliefs, but they come together as a group and help. It's a wonderful site here, especially I'm from Kerala, and there are people helping to research, maybe in ward, in ward level, then division level, area level, regional level groups are formed, and they also help. They are in the forefront of health workers. That's why I say they are working as health, working in, as health professionals and researchers. That's another aspect which I would like to bring to your notice. Okay, a lot of researches and surveys are being done, which will help us to fight this pandemic well. And I would say it's again the youngsters who are in front, and we should also promote. I think the government, many governments are forming these kind of groups in order to make surveys so that they get the right information, and right information to a certain extent is very important for all this. So the youth are working, they are workers, researchers, and help, and they do a lot of surveys and help, what do you call, the government sometimes, and what do you call, doctors. Another thing is, I should say something very, very practical. See, these groups are also giving what you call food. For example, people when they are affected, they often take food to their own houses. Okay, the affected people, and help them. And I think it's the young people who can do it better. And I find young people are doing. See, in our colleges, in our universities, what we find is, and they are also helping the police. For example, we have created groups like student policing. Many of the policemen and people in the executive are affected by COVID, and they come in primary contact, so they go often in quarantine. So it's these people, the student policing. I think it has been very effectively used in Kerala, which any state in India can follow. Okay, these university and college students, okay, they are given a kind of short training, and they work like police officers. Okay, they help the police department here. So and there are groups also helping health workers. There are groups helping what they call the needy, and especially both girls and boys, I should say, young men and women, ladies and gentlemen, all are there in helping and fighting this pandemic. And this gives us a great hope. This great the hope that gives, because it's part of social activism, and these young people are doing, helping all these people. So as a round off, because our first speaker has taken, so I think I must stop here. But I'm sure our youngsters working as social activists, researchers, and also, as health workers are in fact doing a wonderful job to fight this pandemic, and they can do it. And I think only they can do it. So I exhort my dear friends, my dear students all over the world and nearby. Why can't you people, if you have, of course, you may have your own, and these people are doing all these even when I think it's most affected people are also these. Okay, not affected by COVID, but they are affected by, see, I think all over the world the education systems are in a way collapsed. See, I think in 191 countries, I got a survey where almost there is partial closed down schools and colleges, or there is lockdowns. But let me tell you, though there is lockdowns, our youngsters are not down. They are not down. They are doing we are all in lockdown, but our youngsters are not down. They are helping us throughout. And I exhort all others, all youngsters who maybe they have done, because they are worst affected in the sense, see, often when they look, they have a bleak future. The future is not that bright. See, the world economy, Indian economy is also very much affected. Okay, the socio-economic conditions are also affected. So often when they look forward for the jobs, maybe to a certain extent, they may be a little afraid, but at the same time, they are in the forefront fighting. So though they are affected, they are putting up a wonderful show, helping everyone. So I wish all the youth, not only in India, all over the world, and I congratulate them, thank them for being in the forefront to fight this pandemic as researchers, social activists, and health workers. At the same time, I'm sure the working together of this youth can create a healthier, safer, and gender equal world and India. Thank you. Thank you very much. Thank you.
Thank you, brother. Dr. Vargheese KJ.
Thank you.
Associate Professor. As you are a professor, the way you are presenting also absolutely professional, and you have taken care of word to word while you are giving presentation. Really a great motivation to our youngsters. It's a lockdown, but our youngsters are not down. Yes, that's a great, brother. It's a really great. Yes, they connect themselves with that. Surely, brother. The problem with India is we have so many sources. We have so many resources. We have got good manpower, infrastructure, everything. But the problem is we are unable to focus on the problem. We are diverting our minds. If really our central government of India takes this as a urgent situation or a mandatory issue, they can rectify it within a 1 month time. But it is when the pandemic is politicized. In India, pandemic is politicized. So
I didn't speak about that. I never entered that. I never entered that area.
It's not talking about you. It's not your version. No. Yeah. I'm not going to talk about you, brother. But here in India, I'm telling. So
that's it. Yes, sir.
So it's not your version, brother. It's not your version.
No, not my version. That, but I didn't speak about it in general. I spoke very general, sir.
Yes,
Otherwise, yes, our government, as you said, we have great resources, great young manpower. We can use, if we can use it, and I think they have divided attention. Our political leaders, even our religious leaders, have divided attention. Otherwise, things would have been settled. That's it. Thank you, sir.
Yes. So, the pandemic has been politicized here. So, the problem is getting delayed. So, once all our resources come onto one platform, so we can save millions of people. That happens because we have power, capital, infrastructure, eminent leaders, youngsters, youth, good manpower, human resources. We have everything. But the problem is we are unable to put into action. The day comes. But if it is getting delayed, we are losing so many lives. That happens. Okay, anyway, we pray for the best for our nation. So that happens. Then I would like to invite our next speaker, Dr. Vijay Kumar from Cuddalore. Cuddalore is the place when we are talking about a pandemic. This is the place that was hit by tsunami long back in 2000, the beginning of 2000. They experienced the worst. The people, those who are in Cuddalore, he is from there. So we invite him heartily, Dr. L. Vijay Kumar to speak on the issue. Brother, please.
Okay, sir. Happy evening, all. Sir, audible, sir?
Yes, brother, it's audible.
Yes, sir.
Okay.
Sure.
Happy evening, all. I would like to thank Mr. Raja Rao for giving me this opportunity to participate in this Zoom meeting and to share my ideas about youth leading the way against the pandemic situation. We, the poor, are immune to the coronavirus. Few statements have been so outstandingly false and misleading. The pandemic has taken a disappropriate toll on the underprivileged. Not only they are highly exposed to the virus. Many are essential workers do not have the sick leave and cannot telework, but they are also more likely to get severely sick. Many do not have access to quality health care and have higher rates of chronic disease that increase the risk of severe disease. In addition, has they suffered, they have suffered the most from the economic and social consequences. The lockdowns. One minute, sir. Sorry, sir. In addition, they have. Hello, sir. Audible, sir.
It's audible, but your face is not visible, brother. Your hand is covering your video. Okay.
In addition, they have suffered the most from the economic and social consequences of the lockdowns. Children who cannot follow online schoolings and the rise in domestic violence and teenage pregnancies, among others. A recent survey shows that 3 in 4 households suffered a decline in income, with 82% of poorer households affected. In fact, every type of inequality, gender amplified during this pandemic. To cite some examples, in the US and the UK, Black, Asian, Latins, and other minority ethnic groups were 4 times more likely to die from COVID-19. People who live in deprived areas had higher diagnosis rates and death rates than those living in less deprived areas. In Spain, recent survey prevalence results show that women work as cleaners or carers as well as migrants were more exposed to the virus than the general populations. Borrowing a line by British writer Damon Barrer, we may be in the same storm, but we are in different boats. Be fast, have no regrets. If you need to be right before you move, you will never win. And said Mike Ryan, immunologist at WHO in March. Without any doubt, the countries the best succeed in curbing the spread of the virus and even eliminating it from their territory were not necessarily those with more resources, but rather those who did not. Elderly and other group increase of become infected and by comparing stigma and descriptions. So 10 ways of young people are leading the way against COVID-19. providing essential reproductive productive health service
Brother
and
Vijay garu,
championship. Using social, sir.
please come to conclusion.
Hello. Okay, sir. Using social media and apps to spread accurate information, harnessing the strength of communications, delivering food and sanitation. So, ensuring the vulnerable are not left behind. Several reports shows that the settings, particularly groups are who are displaced and are living in camps may experience the direct effects of COVID-19. Young people like are raising their voices to make sure this population don't get left behind in the crisis. As liaison officer at White Helmets, a voluntary organization that has gained international attention for rescuing wounded civilians during a civil war. So, global effort to export technology, money, and materials to save lives everywhere, including Syria, were crowded the refugees, girls and women, especially vulnerable to the diseases. Thank you, sir.
Thank you, brother. Thank you so much. Brother, there is some problem with your visuals. That's why it is looking a bit disturbing. Okay, now I invite Ambassador Muhammad Siraj, an international public speaker. Brother, over to you.
Thank you, sir. Very great evening to one and all, and great dignitaries on the panel and in the Zoom session. I would like to thank Dr. Raja Rao Garu for inviting me for the great opportunity to speak in front of the world about the youth, what type of advantages and situation they are facing and what they need from us as a leader. So we need to discuss and contribute some experience and skills to them. So before I start, I would like to congratulate each and everyone, those who came here for contributing your experience towards a great initiative for coming back and showing some positivity towards the youth. It's a great honor to represent here in front of you all. So first of all, as our main theme, what is that is youth. Who are youth? Youth are the backbone of country, as we all know. Right now the situation is quite different from 2 years back. The situation is totally changed for youth. Earlier, youth are the growing stage where they have a lot of challenging in their life. They need to build great nations, great society, great school, great colleges, and they need to have great future towards a beautiful world. But the situation is totally changed now. Due to that, we need to change as their we need to change their thinking ability. For example, if I as a soft skill trainer, if I speak corporate trainer, the skills which they required for upcoming years or need to be learned in this pandemic, and they need to come up with lot of skills which can be learned by the sources are available in internet. This is a good opportunity for the youth to learn and explore themselves towards a great future. And coming to the career part, as the colleges and schools are still need time to open as their normally they used to study. Now it's totally changed into the visual sessions. What are the effects they are facing in this education system from earlier? The usage of screen and mobile and laptop are used more than earlier. Because of that, their eyes are affected by watching long term of screening, by playing games and lot of things. So they need to make good schedule for using the mobile and screening programs, whatever they watch. They need to have proper schedule. As per youth, they are using more social media. There are two advantages by using social media. One is good, they get awareness about the COVID-19. And as someone said, the great leader, the effective of negativity will increase because of social media. So the positive thing we need to see, and we need to go with the learning part. As a youth, they are the next generation where every country looks towards the generation to come up with the creativity and launch some research and go with the entrepreneurship and make a great nation by introducing a lot of new concepts. but the situation is totally changed. In this situation, they need to give themselves a proper routine like physical activity, mental health, education, and timing, and being spending time with loved ones, and utilizing time for giving help those who need, and voluntary programs. Most of the youth I have seen doing voluntary programs around the world. They are the great warriors of world, those who come up with the good initiatives. I've seen one girl who established a small uh, like a sanitizer box which is made up of free of cost with waste items which are available at home. By without touching, we can use that sanitizing system to wash our hands. So there are great minds and ideas in our children, but the thing is, in this time, what they're contributing towards the society. So like that, if every individual, every child, every persons think that we need to contribute, we are the responsible for the recovery of COVID-19, then it is possible that we can have good steps. So as a youth, what is your responsibility towards the world? The main question comes to you. So if you are a responsible person, then what you are doing for the recovery or going for the normal stage, what are the steps you are using? So first thing, wearing mask, wearing gloves, and maintaining 8 meters distance from the normal, and giving awareness to the uneducated people, those who are around you. There are 30 to 40% people that still don't have aware about what are the precautions they need to take. As a youth, you are the educated person. You can educate a lot of people and to the world what are the precaution steps we need to take primarily. So that is a voluntary basic thing. As every individual of the youth, they should know, they should, there is no criteria for giving them a tag like voluntary. You need to act like a voluntary. So opportunity will never knock you. You need to take an opportunity. So you need to take opportunity. So from that opportunity, you can do a lot of miracles. I would like to convince all the youth, those who are listening to me, please maintain proper schedule in this pandemic. Like your health is very important, your mental health is very important, and your education is very important, and your social work is very important. So try to make a proper schedule and come up with the new initiatives and make a good revolution, good changes, transformation in the society so that they can see you and they can learn. So that is the main part of the youth to come up with good initiatives. Finally, I would like to conclude my speech by saying that it's a responsibility of every individual, those who are watching as a youth. You need to come up and you can share the whatever you find, good sources, whatever you find, this is a relevant experience I need to share. Use your social media and give awareness and come up with initiatives. I would like to share. I have seen so many students, those who don't have, for the COVID situation, those who are died or those who are feeling sick, they don't have family, they are coming up with helping them for everything, whatever they need, like medicine, like food, and sending them to the home. So like that, some of the initiatives which are great impact on the society. So by seeing them, most of the members, they learn how humanity works towards a great nation. So every individual, every youth need to have proper instructions from their parents and educate people about the awareness and focus on your education as well. As schools and colleges will take time to open, make consistency of your education, take out your subjects and take some time and read it and make yourself engaging with the knowledge and experience, and give some time to your family and give some time to the volunteership. And this is the final message to you. Take care of yourself and be strong and be connected with each and everyone to support in this situation, and maintain the precautions which is given guidelines by the central government and state government, and help them with your social media. You have a great tool and weapons in your hands so that positivity you can spread and you can give awareness and you can save at least one life. You can be a great person in the world. Thank you so much.
Thank you, Brother Siraj. Simple words, but powerful message.
Yes.
Thank you so much.
Thank you.
Almost all are young leaders, so their speeches are connecting with all youngsters. Thank you so much for your wonderful message. Now I would like to invite, as usual, our participant guests. We recognize the presence of Tasneem ma'am. Tasneem ma'am, can you share one or two words with us? We recognize the presence of Her Excellency Tasneem ma'am. Please. Dr. Matthews. Dr. Matthews, Muhammad General Prince. Only 1 minute. A participant guest will get only 1 minute. Okay. Anyway, it's our time is over today. Dr. Muhammad. Young leader Muhammad. Noor Ahmad.
Thank you so much for wonderful words, Ambassador Siraj brother. It's really inspiring for us. Yes, I'm the youth ambassador and I'm focusing on your words, what you are sharing with us. Well, in spite of having so much complication during the pandemic situation, the young people particularly have been disproportionately affected by the pandemic. The International Labour Organization reports that the more than 1 in 6 young people have been unemployed since the beginning of the pandemic and during the time as well. So I'm not focusing on that. What the outcome during the pandemic for the youth? I will share those by points. Number 1, youth providing the essential reproductive health service and companionship with the organization to organization. Another one that is using social media and apps to spread the accurate information to the all. Another one that is speaking out for the effective and equitable case. For the young doctor, young youth leaders, they are sharing the information continuously to spread the positive message towards the victim. So another one that is innovative to improve access to life-saving testing. For the testing, for the coronavirus testing purpose, most of the young professionals, they are working for that, and some volunteer as well. So in the another points I have to share, that is conducting research and developing technology. This time, the most of the youth are focusing on this because of research and developing technology. They are providing some easiest way to conduct the education, conduct the other social platform to spread the news, positive vibes, as well as the youth movements around the world. I have to say another point for the delivering food and sanitation. Youth are the part of this. You know, in international organization, they are focusing on the project. That's this kind of project going on, but youth are the main implementing person. So for the any kinds of project implementation, youth are the vital part of any project. So I have to share another word, that is youth are ensuring the most vulnerable are not left behind. Even the youth are innovating some ideas, ways and things to be positive during the pandemic situation, and they just innovate some technical things that make it easy to adopt in during the situation. That's all about my part. Thank you, brother Rajarao. It's my pleasure that I'm getting chance all the time, at least 1 minute. So thanks for hearing me with passion.
Thank you, brothers. Thank you so much. Now it's a time for vote of thanks. Today we have fantastic young leaders whom I have to thank. Really, Ibrahim Alpha Moigua from Sierra Leone. He started with energy, and Dr. Vargheese brother is so fantastic. He has given perfection to the program. Dr. Vijay Kumar brother, though he is perfect, but due to some technical problems, he was unable to present it properly. But next time, he will come with proper tools and internet. Then I would like to thank Siraj brother. He is very dynamic, simple words, powerful messages. It's a nice way because everyone can understand easily. So 4 amazing pillars to this program made it a day. Thank you, brother. Thank you so much. So finally, my message only one word to the youngsters. Learn to question leaders. Don't follow your leaders blindly. Don't follow politicians blindly. You may belong to any party, but learn to question. So when youngsters are able to question, then solutions to all problems in the nation will be answered. But if we keep on supporting our leaders blindly, we see all the dead bodies on the streets and in the rivers. So this is what happens. Once again, I request all the young leaders, youngsters, learn to question. So that will become fantastic. Our nation becomes powerful. Thank you.
I can go, Madam. I'm very happy.
Emil and ma'am. Ma'am, will you share a few words?
Hi, sir. Can you hear me?
Yes, ma'am. It's audible. Please. Please, ma'am.
Oh, yeah. It's a pleasure to be here. And it's a great pleasure to meet all the leaders here. Yes, it's true what you said, Dr. Raja Rao. We have to question all the youngsters. You do not blindly follow. Questions are important so that you will be able to improve yourself, as well as you will know why are you doing it, instead of following it blindly. Know why you're doing it before you do it. I think what you said is very, very true, Dr. Raja Rao. I agree with you.
Thank you so much, ma'am. Okay, so with this, we are concluding this program. Thank you once again. Thank you so much, everyone.
Thank you, sir.
You all, thank you very much.